Hi everyone, I'm Ilan Navarro and I'm going live today with Dr. Todd Hill from Neuro Wellness Spa. He is a psychiatrist and we're going to be talking about ketamine and alternative treatments. So I am happy to have you here. Hello to everyone joining. Nice to see some friendly faces, familiar faces. So we are going to get started in just 1 second, waiting for Dr. Hill to join us. I'm going to pull up my questions and feel free to engage, make this as interactive as you would like. There is the little question mark bubble down at the bottom if you want to shoot us questions throughout. Sometimes it's a little hard to follow along with the chat, so and I'm hoping I did this right. I think I just added, there we go. Hello.
Hello, how are you?
I'm wonderful. How are you?
I'm doing well, thanks. Nice to meet you.
So nice to meet you too. Thank you for taking some time to chat. I was just reviewing your bio and I'm so excited to talk to you.
I was finishing up seeing patients and we're running in and out, so it was awesome.
Perfect. Cool. It's live and in action. This is how it works.
I like it. No problem.
Yes. So just, I'm going to give a little brief intro of who you are to the audience. I'm sure I've abbreviated it tremendously, so forgive me if I leave things out. But Dr. Hill is joining us. He's currently with Neuro Wellness Spa, but you've been practicing psychiatry for over 21 years, and you've been in private practice as well as on staff in hospitals, as well as assistant professor. So you've kind of done it all in the field of psychiatry. And I love this in your bio. You believe in common sense psychiatry and cutting edge treatment alternatives, which include providing patients with as much information as possible about their illness. I think that's something we have in common. We like very much informed decision making when it comes to mental health. And your personal philosophy is with more education, there would be less medication. I love that.
Without a doubt. And, you know, the patients do so much better. And, you know, because I, went through your Instagram and you're all about educating people, and people do really well when they're empowered and with everything we tell them and work with them, as opposed to telling them what to do, giving them the choice and educating them.
Yeah,
exactly.
Yeah, I think the number one feedback I get from my patients when they're afraid to see a psychiatrist is because there's such a hierarchy they feel. They feel like they're being talked at, or they're only given one option, or like you said, being told what to do. And that's kind of why they choose not to get support. And they don't even realize that there's such a variety of different options on how you can get psychiatric support. It doesn't just have to be, take this pill every day. So,
well, and that's one of my pet peeves with psychiatry. And I could probably give you 100 reasons why people don't want to see a psychiatrist, because, a lot of psychiatrists, that's all they do are push pills. And, and people like you and me, you're better at it. You push skills and the patients do well. A lot of my colleagues, my internal medicine colleagues, and I was like, the psychiatric patients, they never really get better. I go, yeah, they do. Yes, they do. They really do. And I try to encourage some of my patients, that are seeing me every 3 to 6 months. It's like, you can go back and see your primary care doc to get this medication. You don't have to keep seeing me. And they go, oh, no, we're going to keep seeing you. But people do get better. And I think that is part of the stigma of mental illness, is that, okay, once you have it, you never get better. It's a weakness. And it's not. It's environmental, it's genetic, and definitely treatable. But I think we've missed the boat a lot with pharmaceuticals in the past 40 to 50 years, but that's what we'll talk about today.
Yes, absolutely. Absolutely. I was just finished watching the series Painkiller, and I don't know if you ever saw Painkiller or Dope Sick. I mean,
I saw Dope Sick.
Different. Yeah, that's totally different kind of medicine, but same thing, there's like stigma around, am I going to get addicted to this? Or is this going to be for the rest of my life? Or what does this mean about me that I have to take medication? So let's just kind of dive into it.
Yeah. Is it going to change who I am?
Pardon?
That's one thing I always get. Is it going to change who I am, and am I going to be on it the rest of my life?
Yes.
Those are like two common questions.
Yes.
Yeah.
Yes. And I know that you're a musician also, and I used to work in the entertainment industry. So working with a lot of creative professionals. Well, yes, exactly.
I got my guitar in the back.
The guitar in the back. Yeah. Working with creative professionals, that's kind of the number one thing they're afraid of is, am I going to lose my creativity, my edge, my passion? I don't want to be a zombie. I want to still be able to feel my emotions. So let's just kind of dive into it.
Okay.
I really want to focus on ketamine specifically because I thought it was just kind of like totally this mainstream, type of treatment already, because I've had patients of mine on it for several years now with major depression or eating disorders. It's just been so much in my, day-to-day knowledge. But recently I had a client that was just so curious and knew nothing about it and was really afraid of ketamine when her psychiatrist mentioned it. So I would love to just kind of break down stigmas. What do people need to know? Where do we begin? What kind of category does ketamine fall into? Is it something that someone can get addicted to? Let's just start off with a jumping point.
Cool.
Whatever you'd like to start with.
All right. Well, the interesting thing about ketamine, it's been around since probably 1960, the early 60s as an anesthetic. And so that was the primary function of ketamine. They use it in surgery. They use it in veterinary surgery. We use it in the hospital. We use it in the emergency room. If somebody comes in and they're agitated and combative, ketamine calms them down. And they have it on the ambulance, and EMTs have it. And what we've noticed over the years is that ketamine does calm people down, but there's this antidepressant part of it. I think when they were in the early uses of ketamine, somebody would come into a psychiatric hospital, they'd be suicidal, and some of the early studies, they would give them IV ketamine. The next day, their depression's gone and they're not suicidal. Now, it didn't last, but it obviously triggered interest into the research of ketamine for depression. And then lo and behold, years later, we're using ketamine more often for depression. And it started out mainly they were using it intravenously. And the key, though, like you said, is it a drug that people abuse? Well, we're using it for depression, but ketamine's been well known on the street for quite a while, and it has been known to be a recreational drug. People talk about Special K is one that they talk about on the streets, or going in a K-hole or something. So it's kind of a party drug like ecstasy was. And so any of those drugs, just like the psychedelics, which we'll talk about as well, they get a bad rap when a lot of them actually do have therapeutic properties. So, bona fide research starts looking at ketamine and start looking at the effects of ketamine on the brain. And the wild thing about ketamine is that it actually affects neuroplasticity. And the best way to look at that, your neurons talk to each other better. It's almost like you grow neurons, if there is a way of looking at it. When you look at a neuron before ketamine and a neuron after ketamine, the neuron after ketamine has all these little projections where they're talking to other neurons. So it affects neuroplasticity. None of the pharmaceuticals, the SSRIs, none of those medications do that. They may modulate, but they don't affect neuroplasticity. And so we started looking at the benefits of ketamine. And the other thing I think that made ketamine so popular is that when you look at medications, oral medications, rarely, I don't want to say rarely, but not common is it that people get to remission. You may take an antidepressant, you may get a response half the time. And I try to be honest with my patients, it's kind of 50-50. And to get to remission where you have little or no symptoms, maybe 30 to 40%. And that's why we're looking at all these alternative treatments. Now, you throw some therapy in there, it's better, no doubt. Medications by themselves, 30 to 40% remission. Good therapy, now we're talking 60% remission. Well, why not come up, if we're going to use medication, let's come up with a medication that will at least get us to remission maybe 60% of the time or more. And that's where ketamine comes in. So I think we've been missing the boat. I mean, Prozac's been around for 40 years, all of these antidepressants. But if you look at the suicide rate, it's not really gone down. In fact, probably gone up a little, and especially depending on the age group, and females especially, and you know that. And so obviously we're missing the boat, and that's where I think we, focused our interests on drugs like ketamine. And ketamine, is it a psychedelic? Is it not a psychedelic? We hear that all the time because we have psilocybin and LSD and all these other treatments that they're looking at, MDMA. It's semi-psychedelic because it does induce kind of a dissociative state. So it still kind of falls under that category. But if you think about it, it's still an anesthetic from the 1960s. So, and it's not for everybody, and substance abuse and abusing ketamine is a real thing. So you have to keep that in mind when you're picking the patient for this.
Got it. Would a patient who has substance abuse history not be a good candidate for ketamine if their current symptoms are major depression or anything outside of specifically addiction?
It depends on how long they've actually been sober. I like at least 3 months, 90 days, or 3 to 6 months of sobriety, and they're in treatment still. Yep. And you and I get to know our patients and our clients, and we try to anyway, even though you try to believe them most of the time.
Right.
But I think the more experience that people like you and me have, we get an idea that, I think they're ready for this. Now, if they're actively using substances, absolutely not. But if they're struggling with treatment-resistant depression and they're clean and sober and they've been in a good program, absolutely. And it will help. A lot of times these people are self-medicating. So if you get their depression under control, you're going to reduce the risk of relapse as well.
Exactly.
And so, no, it's not no, 100% no, but with some qualifications.
Great. That's really good to know.
Mm-hmm.
And is it a substitute for other medications? I have clients that, again, stigma, unfortunately, keeps them from even entertaining the idea of talking to a psychiatrist or exploring medication, antidepressants, anti-anxiety, anything that they would have to take daily. There's this fear of, I'm going to have to take it for the rest of my life, or I'm dependent on it. Is ketamine an alternative to, or is it in conjunction with daily medication?
So, since ketamine did spark a lot of interest, well, the drug companies started to listen. And in 2020, ketamine, a form of ketamine, was approved by the FDA. And it's a nasal ketamine. It's called S-ketamine.
Okay.
Now, if you are going to get approved, and insurance does cover it, but for insurance to cover it, the actual FDA indication is that you are taking an antidepressant at the time. So it's adjunctive. It's an add-on.
Okay.
All right. So in that case, it's an add-on. You have to have tried and failed 2 or 3 medications. You have to have proven treatment-resistant depression. And then insurance companies look at it with a magnifying glass, and insurance companies could be a whole nother topic with me. All right. Mm-hmm. Yeah. So anyway, yeah. Mm-hmm. And they're trying to tell us what to do, and it's like, sorry, we're the doctors and we're the professionals. But anyway, so it's adjunctive with the nasal ketamine, and I do this because it's kind of a nasal spray. Now, with the IV ketamine and those forms of ketamine, it just may be monotherapy for those patients, and that's all they're taking. And and you don't, they're not going to take it the rest of their life. They may need some maintenance. With IV ketamine, for example, it's often 2 treatments a week for 3 weeks. All right. And then maybe 1 a week for a couple weeks. And then we kind of see how things go. Some people may come in once a month, but that's still better than taking a pill every day. Now, again, it is a chemical in the body. I get it. But, it's a chemical that actually helps your brain grow. Yeah. And it works from the inside of the cell out, as opposed to just kind of bathing your neurons in serotonin and norepinephrine. And so FDA says you got to be on something if you're going to be insurance approved for the nasal ketamine. It's called Spravato. is the nasal ketamine. S-ketamine is the generic, Spravato is the brand name. But, you know, for the IV ketamine, I mean, monotherapy.
Okay.
And, you know, and there are oral forms of ketamine too, you
Mm-hmm.
know, and you can get it online and you do in-home therapy. You know, I'm kind of iffy on that, you know, because I think that the ketamine works the best if you have a therapist guiding you through the experience.
Yes.
Either in the session or at least getting some therapy before on what to expect. With all of these psychedelic like medications, and you know this, it's all about set and setting. Set is educating the person about what they're going to experience to the best that you can.
Yeah.
You know, setting the positive affirmations, you know, set up what they want to get out of the treatment ahead of time. And then the setting is the actual environment of getting the ketamine. So I just think in a professional environment, be it whether it's the Spravato or the IV ketamine, you need the integrative therapy with it. You really, really do. And even, you know, in we call it the Green Journal, the Journal of the American Psychiatric Association, they had a recent study, I think it was last December, which talked about the fact that ketamine works better if you have that integrative therapy with it.
Yeah.
Because, you know, you can dissociate all you want and you can experience these enlightening, you know, experiences, but without some guidance on what to do with it or what to expect, it's not as powerful.
Yeah. That's definitely the experience I've had with my clients. You know, it's all about integration. You're going to have the experience, but even with a therapy session, okay, we talk about something, 99% of the time we forget. We're not
right.
So accountability, it's reminders, it's integrating it into your life or your particular challenges that are present for you right now.
And doing it at home, you know, you're not going to get that unless you have a therapist that makes house calls, you
right.
know. And I know they do have telepsych for in-home ketamine, but again, and you know, telepsych, it does, obviously we do it every day, but I think ketamine in a controlled setting with either an appointment with your therapist before and definitely the day after is a game changer. No doubt is it a game changer.
Yes.
And you need to have somebody that, you know, that's trained on what the person's going to experience. But I mean, compared to, you know, medicine that we prescribe, it is a game changer. And I've prescribed IV ketamine, I've prescribed Spravato, so I've had patients on both. I've had patients getting, you know, the transcranial magnetic stimulation that we do here as well, and ketamine. And these are all tools in our toolkit now where people are actually getting better.
Yeah. Absolutely. I think the most fascinating thing is how the neurons or the neural pathways, they just kind of grow after this medication. I think that's
like
so
in an hour.
Phenomenal.
In the first hour. Now, granted, you know, there's a little bit, you know, kind of go back a little, but the more treatments you get, but they see changes within an hour. Okay.
And so what does that mean? You're having different thoughts. You're able to access different emotions. What does neural pathway growth, how does that translate into a person's experience?
So, you know, I guess the best way to look at it is like it connects your subconscious with your conscious. And from what you know, I go based on what a lot of my patients tell me, and it gives them a different perspective on the world around them and their position in the world around them. They kind of at least have a purpose, and they kind of figure their sense of purpose. You know, that's one thing I hear. If people have a history of, you know, trauma, or they have like these fears that they can't overcome, you know, before they do a ketamine session, we manifest what that fear is. Let's try to at least kind of get in our head, what is that fear? And then amazing when they get into the ketamine session, and there's always anxiety. It's like, oh my God, am I going to have a bad experience? And I tell them there will be anxiety. Lean into the anxiety, because that's when it gets therapeutic. When you lean into that anxiety, let your brain take you where it's supposed to go. You may not want to go there. No, I don't want to go there. But when you bust through that wall of anxiety into that, whatever the fear or obsession that you have, and it almost like it manifests physically, and then you make it disappear, you blow it up, you wipe it away, and it really wipes it away.
Nice.
And they just come out like describing experiences. It's really hard for them to describe, other than, you know, I feel like doors have opened up for me.
Yeah.
And I'm not afraid anymore. I know my place in the world around me. I hear that a lot. So the subconscious, I think, connects with the conscious, with, you know, parts of your brain, your limbic system, your emotions. All these areas start communicating that weren't before. Maybe because the connections weren't there, or because subconsciously we were holding them down. And that's your area of expertise. I mean, subconsciously we hold back so much. I mean, all of us.
Oh, yes. Yes. For good reason. We have to establish safety. So
and fear shouldn't, you know, fear is something that holds a lot of us back, you know, and you like to think that sometimes fear can be motivating, but only for so long.
Yeah, absolutely.
Yep. But I'm not a therapist. So,
No, you know what you're talking about. I want to also really importantly touch upon, I've seen a lot of ketamine clinics, and like you mentioned, you know, online availability of ketamine popping up. I feel like it's become very trendy as of late. What should people look out for to know that this is a legitimate practice, that they're going to be held and contained? They're not just going to be left, you know, to have this experience that might feel out of body or outer worldly for them. What should they keep an eye out for, given?
Well, and you know, that's the setting part.
Yes.
Okay. So you definitely want a clinic that has obviously a physician associated with it, preferably a psychiatrist. But to tell you the truth, some of my really good ketamine IV clinics are run by anesthesiologists too.
Okay.
But the one thing about the anesthesiology clinics is that they have a therapist and a psychiatrist on staff. So you want to make sure there is some wraparound mental health care with it. All right. Because you're right. I mean, there's a lot of ketamine clinics. You go in, you get your treatment, you're good to, you know, bye. You can't drive for an hour. Or you can't, you know, you gotta have you're there for an hour, you gotta have somebody drive you home. But I think having that set and setting where you're, you know, you meet with a psychiatrist or a psychologist ahead of time, and they talk about the medical part of ketamine, the psychiatric part of ketamine, and what to expect, and to have follow-up. You know, they need to make sure that they have a follow-up with either a therapist in the clinic, or that they have a psychiatrist that they see regularly, preferably, you know, really a therapist that they see regularly and they can follow up with. You know, a ketamine clinic that's just, you know, you're right, there are a bunch of them. And there has to be the mental health support component, or you're just going in and getting high.
Yeah.
You know, I hate to say that, but and you know, and you got to watch that too, because some people are like, wow, you know, I'm going to come 3 times this week. And like, are you seeing your doctor? Nah, it makes me feel better. So you have to watch that. But I think a clinic that you have wraparound mental health care with is the best way to go. Or they have somebody on staff that is a mental health expert, either an integrative therapist, a psychologist, or a psychiatrist. But, you know, there are some good IV ketamine clinics that are run by anesthesiologists, but they have the mental health care. And, you know, and you go in, and you want to make sure, you may even want to visit it before you go do your first infusion. And I visited some of the clinics up here, and it's a calm setting. They have nice, comfortable chairs. They make sure, you know, a lot of people wear a sleep mask. They talk to you about the choice of music, because ketamine, the music that you choose, extremely important, not only in ketamine, but all psychedelic experiences. Mm-hmm. There's ketamine playlists on Spotify.
Wow.
So, you know, go visit the clinic first. And if you get a good feeling and they have that mental health component, that's what I look for.
Yeah. And that ties into the informed care that we were talking about also. I'm a firm believer in tuning into what resonates in your body. If you go into the clinic, for example, and there's something in your gut, or your, you know, body's reacting and not even consciously or logically, that might be feedback for you to maybe explore something else.
Yeah, I don't know about you, but I always tell my medical students and residents, go with your
Yeah.
gut.
Yeah.
And when you're assessing somebody and you may be a little worried, although they're telling you everything that you want to hear in a good way, go with your gut.
Yeah.
Yeah, that is the main thing. You really want to investigate it and get that good feeling, because there are side effects from ketamine, and ketamine's not for everybody. And we monitor blood pressure. Some people get nauseous, so we have anti-nausea medication. So it's not to be taken lightly. I mean, you have to be monitored, and you can't drive home. You got to have somebody drive you home. And even though people, really when it wears off, you're pretty good. But no, I mean, you have to have somebody drive you home, even with the nasal ketamine.
Okay.
Yeah.
Yeah, that's very important. Very important. Mm-hmm. I know we only have a few minutes left.
We're fine.
Could you
share? I could talk
with,
all day. So
anyway, I appreciate that.
Yeah.
I appreciate that. What can someone expect from the first treatment? If they're super skeptical, they don't know what they're walking into, more so result, like what can they expect to notice after a first initial treatment?
After the first treatment, now, for example, with IV ketamine, they're going to titrate you up, work up your dose. So you may not get, you'll get a lower dose. It's based on weight.
Okay.
And even with the nasal ketamine, you start at kind of a lower dose. The first treatment, it's a lot of calming type experience, and you may experience some dissociation your first treatment, but you will experience a lifting in your mood after the first treatment. It may not be life-changing after the first treatment, but you'll have, it's like a, wow, I didn't expect that, and I'm going to go home and think about that. And, I never thought my brain would take me there. And so we increase the dose with each treatment so that you increase the efficacy, the benefit. But it's kind of more of a calming, serene type experience the first time. But your mood does improve after one treatment. Now, it's not life-changing after one treatment, but better than just after taking one Prozac.
Amazing.
For sure. No comparison. Absolutely no comparison.
Amazing. Yeah. Wonderful. Wonderful. How can people get in touch with you if they have really connected to what you're saying and are curious and want to know more? What's the best way to get in touch with you?
Well, they can go on the Neuro Wellness Spa website, I believe. And
right.
Now you're asking me about marketing and all
I
that.
will tag
I treat patients.
We will handle all of that.
Yes. So I know that with Neuro Wellness, I just started up here in Westlake Village in February. So I was running the clinic in Manhattan Beach where we were doing IV and Spravato. They're still doing nasal Spravato in Manhattan Beach. I know they're doing it at a clinic a Neuro Wellness clinic in Santa Monica. We're going to probably be doing it in Encino come the fall, because I want to get it back in my office. I love it, and where the whole world of psychiatry is going towards psychedelics.
Amazing.
So they can get on the website to neurowellnessspa.com and call the intake department, and they can connect them with one of the clinics that is doing ketamine. And the good thing about it is, one thing you look for, that we're all mental health providers. We have nurse practitioners, we have psychiatrists, we have a network of therapists that we refer to, integrative therapists. So we connect everybody together, and I've been doing IV ketamine treatments for almost 2 years. And I know that the Spravato we started doing pretty much a year after it was approved. Right. So there's a lot of experience there, and we do all the insurance authorizations and take care of all that for you.
Amazing.
And then get you all set up. And the nasal, in terms, as I told you with the IV, it's like twice a week for 3 weeks. The Spravato is like twice a week for 4 weeks, and then once a week for 4 weeks, and then maintenance like every other week.
Amazing.
So it's a time commitment.
Yeah.
But I mean, again, once you get through it, you're not chained to the pharmacy.
Right. And I think, when people explore alternative treatments, they are at a place in their lives where they are desperate for change. They really are going to invest in this process in the hope that it will have an effect on them. So, and I've had patients of mine work with your clinic, with you in particular, and they've had amazing experiences and really positive feedback on what a cool doctor you are.
I'm pretty down to earth. I mean, it's like,
that's some good feedback.
What you see here is exactly the way I'm at home. And I think, you know, what you said about, you know, common sense psychiatry. I mean, one thing I always said, compassionate, conservative, and common sense psychiatry. And, you know, and I try to tell my med students and residents this as well, park your ego at the door. You know, you're going into a field where you do not judge people, because you cannot genuinely take care of people if you're going to judge people, you know. And I get a little emotional thinking about that, because I think of so many doctors out there that don't follow that mantra, and it's not a good thing. People will not get better. Yeah. So yeah, and you know, with the whole psychedelic science down the road, and it really kind of sucks that these are considered alternative treatments when really they should be mainline, first line.
Yeah.
But it is, you know, with the FDA and the insurance companies, where it's an uphill battle.
Yeah.
Mm-hmm.
So bottom line, be informed when you're making your decision.
Yep.
Do your research. Go physically be in the space. Make sure the setting is aligned for you. There was a little comment in here on where people can follow you personally on Instagram, if you would like to give out that information.
I have an Instagram. It is, you're going to laugh. It's Dr. DOCTOR T Diddy.
Love it.
Yeah.
Love
T Diddy.
it. Yeah. Absolutely.
That's what it is for
Is
now.
that a nickname for you? Do people call you T Diddy?
They do.
I love it.
Yeah. Well, you know, one day my kids said, we're going to set up a Twitter. What do you want your Twitter name to? I go, T Diddy Pop Drop. And they go, oh my God, we love that. So T Diddy stuck. Yes.
I love it. I love it. If you could please leave us with a very brief little mental health statement or advice, something that you personally feel connected to, I would be appreciative.
So, you know, I think it is when you're, you know, in terms of like getting mental health treatment, first of all, don't be afraid to get mental health treatment. These are medical conditions, all right? These are not weaknesses. This is, you know, I always tell my patients, this isn't who you are, all right? This is something you have. You know, don't identify with the illness. Separate yourself from the illness. And you know what? Lo and behold, you will get better.
Love that. I love that. I was trained narratively, so I'm a big fan of separating out, you know, the problem, the ailment, the concern. It's, you know, an experience at this moment in time. It is not who you are. So
no, do not identify yourself as the illness. Nope.
Absolutely. Well, thank you so much. I think everyone tuning in got so much information. I'm going to leave this up on my Instagram. It will live there if anyone needs to refer back to it, and they can reach out to you on your Instagram or Neuro Wellness Spa. Thank you so much for taking time to chat.
Thanks. Super meeting you. We've never talked until now.
I know.
Now I feel like we're old friends. Yeah, exactly.
It was so easy and authentic and genuine. I'm very appreciative. Thank you for taking the time.
My pleasure.
All right. Bye.
Thanks.
Bye-bye.
Bye-bye.
For tuning in.